either with members of the Bureau or with the heads of our regional economic communities. And in the course of doing so, I got a sense that we in SADC also needed to, as a community, have a discussion on the topic of the day, which is coronavirus. And I was able to make contact with our chair, President Magufuli, and had a discussion with him. And out of that discussion, the issue that he raised was just a logistical one, that it might be difficult to have a discussion, and he suggested that suggestions could be written down and all that. And I still felt that it was necessary, however, particularly for the immediate neighbors that we have as South Africa, as we are carrying the biggest burden on the continent, and that we've got contagious neighbors that we need to share some thoughts and experiences with. This meeting was then conceptualized, which I shared with a number of my brothers. I could not reach everyone at the same time. We also felt that it would be good, other than just focusing on those who immediately border the Republic of South Africa, that we should also have this experience sharing with Angola, so that we can broaden the reach. I will, following this, also be having a discussion with my brothers in Malawi as well as Zambia, because there are a number of commonalities there as well. So I just thought I should give that as a background to the way the meeting has been structured. I have also in the course drawn in the chair of our organ, President Mnangagwa, particularly as we have interacted at the AU level. There have been some meetings where I've kindly asked our chair of our organ to participate. Last week we also held a meeting with the REX, and unfortunately, to my regret, SADC was not represented at that meeting. And so I did feel that without even holding any official position in SADC, that at the very least we should be able to share experiences amongst us as immediate neighbors, sharing borders, including Angola as well. So that then gives the background to the conceptualization of this meeting. And allow me, therefore, as the initiator of this meeting, to express my deep gratitude to all of you, heads of state and government, and our ministers, for making yourselves available to participate in this vital discussion which we are having on a virtual basis through technology. As we all know, we are all confronted with an unprecedented public health crisis that has far-reaching social and economic consequences for each of our countries. While the numbers of infections...
That sounds, looks like it's a cross sound, like sound, whatever that is.
It might be a good idea to mute on your side, President Masisi.
The President is speaking, but we're not hearing him.
You're not hearing me.
President, you are
following, I was about to criticize President Masisi for not, understanding technology. And I'm the one who is struggling with technology. Anyway, I was born before technology. I don't know whether I had been heard as I was explaining the context to our meeting today.
That part we heard you.
Oh, okay. Okay. Then I was muted on the less important part then. We're still waiting for President Nyusi to join us. However, I just thought that just by way of welcoming everyone, and I may also explain that the agenda that had initially been sent out has been rejigged as to allow all the heads of state to make inputs just after my brief introductory remarks. And thereafter we thought, because in our region, South Africa is the epicenter of this virus, we should then ask two of our colleagues just to give a briefing on some of the measures that we've put in place, and thereafter we could then have a discussion. It's not because South Africa is much more important, it's just that we are carrying the biggest burden on the whole continent. So I think our numbers, while on the African continent compared with other continents, are not as high. However, we are seeing an increase. And of course, we are all concerned about the impact of this virus on our communities and our societies, but more importantly on our economies as well. We therefore thought it was important, as I have already indicated, to have this discussion, largely because whatever we do will have one impact or another on our immediate neighbors. Because this virus does not respect any borders, nor make any differentiation as to nationality. So we therefore need to be responding as we should. Now, considering the social and economic linkages between our countries, when one of us is vulnerable, we all become vulnerable. In our capacity as chair of the African Union, South Africa has been quite involved in various measures undertaken by our union to contain the spread. And I also thought it would be important to share the information in our own region. We have hosted 2 virtual meetings of the Bureau of the Assembly of the AU Heads of State and Government. And amongst other things, the Bureau agreed on the establishment of the AU COVID-19 Response Fund. I must say that it was one of those meetings where we were able to invite other heads of state. We in our region asked the chair of our organ, President Mnangagwa, to participate, and other regions also asked others to participate, not necessarily the heads of their RECs, but we had fairly good participation. So we set up this fund, and we were also able to raise additional funds for the Africa Centers for Disease Control and Prevention. And we've now embarked on a fundraising campaign across the world for this fund to be given the resources. To date, we have managed to raise $25 million for the response fund and an additional 36 million for the Africa Disease Control Center. In our region, Zimbabwe and South Africa were able to contribute funding, as well as some business people as well. We have also appointed 5 African Union COVID-19 special envoys to follow up on the pledges, as well as to mobilize further international support and campaign for international participation. And these envoys that we've appointed are Dr. Ngozi Okonjo-Iweala of Nigeria, and Dr. Kaberuka of Rwanda, Mr. Tiam of Cote d'Ivoire, Trevor Manuel of South Africa, and Mr. Abderrahmane of Algeria. So they are the special envoys that we appointed, who are now scouring the world and campaigning for funding. We've addressed the virtual summit of the G20 and a virtual joint meeting of the World Bank and the IMF, where we called for, among others, the allocation of more special drawing rights allocations to Africa and to provide much needed liquidity to central banks. But we also took time in those engagements to call for the lifting of sanctions against Zimbabwe and Sudan. We also urged for a waiver of all interest payments, as well as the multilateral, as well as bilateral debt, and this would provide the necessary fiscal space for African governments. In general, the response from the international community has been positive, with various partners making pledges, offering debt relief measures, and providing concrete support in the form of medical supplies. With regards to medical supplies, which I'll come to, now, while the World Bank and the IMF have supported a debt standstill for 9 months, we believe that given the extent of the anticipated damage, we will need a debt standstill for 2 years. And in fact, in other meetings, we've also been saying that there should be consideration also of debt cancellations. One of the biggest challenges the continent faces is access to personal protection equipment. As the AU Bureau, we met with several of Africa's business leaders to seek their assistance in ramping up local production of these items and sourcing them from other parts of the world. I felt that there was a need for us to drive this very, very strongly, and therefore appointed Zimbabwean business person Strive Masiyiwa to assist with efforts to source personal protection equipment for the region and the continent. And he had already started this work, working with a number of leaders on our continent, and we felt that we should harness his energy and his capability to do this for us. And I've also engaged with leaders of various countries such as Cuba, as well as China, Russia, France, Canada, and the United States to ask for support for the continent. As for ourselves as the South African government, we've moved quickly to respond to the virus. Our strategy has been the delay of the rate of transmission, but my colleagues will be able to deal with this in a little while. So, colleagues, I thought that we should just give this broad background of the work that we've been engaged in at the continental level and internationally to respond to the virus. And in my conversations with a number of you, I felt the need to also report at home in our own region, so that my brothers should have an idea of the type of work that one has been involved in, the various engagements, and also to draw some wisdom, which I have been fortunate enough to draw from. So it is this that we thought we should give as a background and a context to the reason why we felt it would be important to have this meeting. And I'd like to thank you for agreeing to be part of this dialogue and engagement. I have not dealt with what we are doing in South Africa, as my two colleagues will, as we move after we've heard from the heads of state and government, will be able just to give us a briefing on what we are doing and what stage we are at in dealing with the virus. I am informed that President Nchi has also joined this meeting. And President Nchi, we welcome you and thank you also for participating in this meeting. With that, colleagues, I would then like to ask President Lorenzo, His Excellency President Lorenzo, just to make his remarks, and thereafter we'll then go to other heads of state and government. Thank you very much. President Lorenzo.
Muito obrigado, Presidente Ramaphosa, Presidente Masisi, Presidente Nagangwa, Presidente Nchi. Estou a ver também a senhora Zuma. Muito bom dia.
Thank you very much, Your Excellency, President Ramaphosa, President Nagangwa, President Masisi, and President Nchi. I can also see Madame Zuma. Good morning.
Angola constituiu a Comissão Interministerial de Combate ao Covid-19 ainda no mês de fevereiro.
Angola establishes the Ministerial Committee for the fight against COVID-19 yet in the month of February.
Mas tivemos o primeiro caso de infecção, portanto, o primeiro caso positivo, a 21 de março.
But we had the first positive case on the 21st of March.
6 dias depois, a 27 de março, declaramos o primeiro estado de emergência por um período de 15 dias.
6 days later, on the 27th, we declared the first stage of the state of emergency.
Depois deste primeiro estado de emergência, declaramos mais dois, o último dos quais termina neste final de semana.
After that first stage of 15 days state of emergency, we enact 2 stages as well, which one, the last one is ending this weekend.
E, a princípio, declararemos terceiro, quarto estado de emergência participação, sobretudo de um país europeu, 8 de transmissão local, felizmente apenas 2 perdas vivas ou mortos e 11 recuperados.
As of yesterday, the data regarding COVID-19 in Angola stands as follows. We have had so far 36 positive cases, mostly imported from one of the European countries, and 8 of local transmission. And unfortunately, we have 2 people who died and 11 people have recovered already.
Estamos com uma velocidade de transmissão de 0,8.
We have a transmission speed of about 0.8.
E, felizmente, também ainda não temos a chamada contaminação comunitária, ou transmissão comunitária.
Fortunately, we don't yet have the so-called community transmission.
Todo o nosso trabalho está dirigido no sentido de evitarmos a todo custo chegar a esta situação de transmissão comunitária, que, como sabemos, a exemplo do que vemos em outros países, quando chega a esse estádio, praticamente perde-se o controle.
All our work is being done in order to prevent reaching to that stage of community transmission, because as we've seen in other countries, when a country reaches that stage, all things become very complicated.
Então, a nossa aposta é na prevenção, é tomar as medidas mais rigorosas no sentido de evitarmos chegar a esse estágio de contaminação comunitária.
So all investment is being done in order to prevent the community transmission. Because as we know, when we reach that stage, it becomes much more difficult. So all efforts are being done in order to prevent from reaching that stage.
Estamos neste momento com próximo de 40 mil, portanto, mais exatamente 39.715 cidadãos em quarentena.
So throughout the country, we have a number of 39,715 citizens in quarantine,
Entre os quais 944 em quarentena institucional, sendo os restantes em quarentena domiciliar. e de estrangeiros,
from nationals and foreign citizens,
com destaque para a doação do cidadão chinês Jack Ma,
highlighting the donation by the Chinese citizen Jack Ma,
e cidadãos singulares e empresas, organizações não governamentais e outras, que também prestaram, deram seus donativos, querem recursos financeiros, bens alimentares e bens de materiais de higiene.
these donations come both from individual citizens, companies, non-governmental organizations who have given us donations in form of money, goods such as food and hygiene goods.
Portanto, resumidamente, o presidente Ramaphosa, o presidente Masisi, o presidente Mnangagwa, o presidente Nchi, Mora Zuma, resumidamente, este é o quadro que se vive em Angola até a presente data. Portanto, vamos manter a cerca sanitária nacional, vamos manter a cerca sanitária na província de Luanda, e mais procuraremos, em grande parte do país, ir começando a reativar a economia para que não afetemos muito a vida dos cidadãos, a vida das empresas, de uma forma geral, a economia nacional. Obrigado.
So, in nutshell, President Ramaphosa, President
Well, it seems like the sound has faded. But thank you very much, President Lorenzo. It's now my privilege to ask His Excellency President Masisi to make his remarks. President Masisi. There seems to be something wrong with the sound.
Am I audible now, Your Excellency?
Yes, you seem,
We can hear you now.
you seem to have been doing exactly what I did.
I suspect.
It seems to be hung up now.
It happened now. Good morning again.
Good morning.
Let me begin by expressing my profound gratitude to Your Excellency President Ramaphosa, our eminent chairman of the African Union. And in the same breath, welcome my colleague and senior brothers holding the rank of president in the region, including the ministers partaking in this. I'd like to begin by commending you, President Ramaphosa, for this initiative to allow for a discussion of the regional leaders on COVID-19 so that we can harmonize and optimize our approaches to safeguard the health of our people and our economies. It's no doubt evident to all that COVID-19 is the single most sobering public health emergency the world is experiencing. And in sharing Botswana's response to this, I remain conscious of the unprecedented opportunity for all of us by this challenge. And I need not remind that united and in peaceful collaboration collaboration, we remain impenetrable. This pandemic continues to threaten the very core of global health security, Your Excellencies, and let me delve straight into what we in Botswana have observed and how we have responded. I need hardly state that we're smack in the middle of Southern Africa, almost dependent completely on the economy of South Africa and our other neighbors, particularly for our goods and services. And so in January early this year, our first response was to formulate a committee or activate a National Health Emergency Committee with the support and collaboration of the WHO. But as the threat intensified, I escalated that and formed a presidential task force in March, which I chair to this day. It required, as part of our response, that we urgently enhance our detection, containment, and prevention to arrest this pandemic. And these, among others, included health screenings conducted on a daily basis at all our ports of entry, those that are functional after we, in collaboration with South Africa, reduced the number of borders of entry to manageable levels, particularly the business ones. We strengthened our surveillance along our borders, particularly to curb ungazetted entry and exits. Use of essential and factual messaging to the public was enhanced, and the social mobilization component of the response plan that involved mobilization of leaders across, from our traditional leaders, your COSI, members of parliament, councillors, religious leaders, and other stakeholders in business and society were motivated to draw on the social capital they could bring to bear to enhance our response. We then instituted a 14-day mandatory quarantine on the 24th of March 2020 for all citizens and residents arriving from out of Botswana. And on the 30th of March, we declared a public state of public emergency. The whole reason was to declare state of public emergency restricted because of our democratic credentials to responding primarily to the COVID. So the state of public emergency is for no other reason but to deal with the COVID threat. And then we initiated our first 28-day lockdown, which ended on the 30th of April, as was initially designed, but we extended it by a further 3 weeks, broken into 3 segments, extended by 7 days, as was complete lockdown. And from today, Your Excellencies, a very gentle easing will allow about 25% of our get back to work, and then a week later, we're going to allow for movement in the country, controlled movement with permits across the zones that we have demarcated. We drew a lot of lessons from our control of foot and mouth disease in the past in terms of control of this pandemic. We also, Your Excellencies, have ramped up our capacity to contain, and a prerequisite to that is an enhancement of our test capacity. And so far, from 9,540 tests, and but we've since had 4 of our labs certified, and our maximum capacity at full throttle now stands at 3,000, and we are going to be ease up as we broaden our community testing the disease burden. We have registered 23 cases, positive cases, and 1 fatality. Currently, there are 13 active cases and 3. Active monitoring of movement, and increasingly so at our borders. And he hardly mentioned that one of the biggest challenges we face, as was from the beginning, would be enhanced importation of disease burden, including enhanced local transmission as a result of the increased numbers. So far, we have not opened up for free movement of persons across borders. We've only opened for commercial movement of persons and goods across borders. We have placed very strict protocols on truckers, and we facilitate, to the best of our ability, truckers bringing goods into Botswana or taking goods out of Botswana, and even those in transit, to the extent of escorting them to their destination to ensure compliance. And otherwise, if detection undertaken, they realized, they would be subject to the 14-day quarantine and the necessary protocols. We continue to implement our extreme social distancing measures, as well as the others of clean washing of hands frequently, etc. But we continue to face challenges. Among the challenges we face are the short supply of COVID-19 commodities due to global supply chain limitations. We continue to face challenges of frequent border jumping incidents between our nation states, and the economic impact of COVID-19 to government, the private sector, and individuals is deleterious, not exactly measured, but it is felt right down to the household level. We continue to face challenges of information gaps, collaborating agencies in neighboring countries, and this is where I think, as head of state, we need to work more closely together, which compromises the better facilitation of movement of persons across borders. Your Excellencies, this is against the background of the reality of COVID-19 being an extremely agile disease burden. If you recall briefly, we jumped from 1.4 million global cases in a period of 4 weeks to 3.4 million cases. That's shocking by any measure. And the global fatality rate is at 7 to 8%, with about 240,000 people who have passed on. Roughly 30,000 of these cases are in Africa itself. And the fatality in Africa is just over 1,000, or approximately 3%. In South Africa, as President Ramaphosa acknowledged, currently presents itself as an epicenter with plus 7,000 so cases and about 2% fatality. 25% of these cases in South Africa are representative of all cases in Africa that are registered. So knowing is critical. But more significance to Botswana, and I would imagine to other countries in the region who would trade heavily with South Africa, is that Gauteng, which is the industrial hub of South Africa, has close to 1,000 or so cases, or 14% of all of South Africa's, where most of our goods that we trade South Africa would originate from or transit through. Clearly, COVID follows human movement patterns, and our burden was enhanced by our own citizens returning from abroad, and then local transmission setting in. In one contact tracing case I wish to use as an illustration, one contact, once established, was found to have been responsible for 72 contacts in 10 districts. And that is the enormity of the burden. What I wish to provide as food for thought, Your Excellencies, and perhaps even suggestions of how we could move forward to work together, is that we're going to need to reconfigure how we respond to a threat that does not respect the normal things that we as states respect: sovereignty, territorial integrity, citizenship, trade relations. We're going to need to work around these challenges to manage this disease burden. And so we're going to have to reorder the way we relate, fundamentally. And finally, as with any developing nation, we aspire for things superior and that provide solutions to our problems. So we too are in a quest to generate responses of a technological or biomedical nature to avert, mitigate, and eliminate these burdens. So our quest for knowledge, for competence, for research, intellectual capacity, industrial capacity,